Recording will start soon.
All right, thank you so very much for coming to the second financial weekly meeting of Bureau of BEMSTS and Trauma. I am Catherine Ruiz. I am the ambulance rates analyst. And presenting today, we have Paul Pedersen from Arizona Ambulance of Douglas, Jason Taylor from the City of Mesa, and Edward Armijo from AMR. And just some housekeeping items before we get started. I want to ensure everyone is aware we are recording. This will be posted on our website. So if for some reason you don't want to be on the recording, you don't want to be seen, ensure that you change the settings in your camera or hover your mouse in the center of the screen to disable your camera. We should be doing that to mute ourselves while presenters are speaking anyway. So just kind of hover your mouse if you've never done Hangouts in the middle, mute your microphone, turn off your camera. Ensure that your cell phones and anything else is on mute or silent during the presentation. And we're going to let Shelly do all the presenting. So someone tries to accidentally start presenting. Sorry, Shelly is doing that for us. Anywho, so just to go ahead and begin, we have a lot to get through in 30 minutes. All of these resources will be posted to the website. Any questions that you have, you may ask at the end. So let's go ahead and take it away. Paul, if you please. Paul? Paul? And we can't hear you. If you can unmute yourself. All right, looks like we're having some issues with Paul, so maybe we'll jump to Jason and come back to Paul. Jason?
Okay, I'm here, no pressure. So the first thing I'm going to talk about, and this is agenda item number 3A, is changes to the to some tax deductions that were embedded within the CARES Act. There's two big changes for charitable contributions, which can be made to nonprofit and public EMS agencies. So this doesn't help our private providers, unfortunately, but it does help the nonprofit and public EMS agencies. Basically, these two changes are: first, the deduction is now available for those who take the standard deduction, which is the majority of individuals after the 2017 tax changes. So individuals can deduct $300. Married couples can deduct $600 for contributions to charitable organizations, and again, that includes the nonprofit and public EMS agencies. And this is what's called an above-the-line deduction. So again, it's you don't have to worry about itemizing like you used to. On the other hand, for wealthier individuals and corporations who do itemize, the charitable deduction cap was increased. So the bottom line is that there are some winners in this economy. I think we all know that. I would consider asking them to take advantage of this and donate to your EMS agency if you're eligible. And on the screen, this article that was written by Steve Worth in EMS 1, and that has some more information if you want to refer to that. Agenda item 3B is really a follow-up item. Also within the CARES Act, Provider Relief Fund. This is referring to the HHS stimulus. Most of us received our first payment under that last Monday. I believe it was last Monday. Payment is due to come out tomorrow. This time there's a slight difference, whereas before it just kind of automatically got deposited into your account. That may happen if you were in that first round of CMS cost reporting. This time, if you weren't in that first round, you're going to have to go to the hhs.gov website that actually Shelly has up on the screen right now. When I checked this morning, they did not have this second portal open. So there on the screen, you can see the attestation portal that came on a little bit late. My understanding is there's going to be another portal that comes up. Previous screen, Shelly, sorry.
I'm sorry.
No, that's okay. Keep checking. At some point, my understanding is there's going to be another link on this page to the portal where providers are supposed to add what their Medicare fee-for-service revenue was for 2019. And once you do that, then they will distribute the funding to you if you want it. And actually, I think the other providers, even if they did that, participated in the cost study, they will eventually need to go in there and attest to what their revenue was. But if you weren't selected in the cost study, make sure and do that on the front end. And again, the payments are supposed to come out tomorrow. If we could go to the page you just had up then, Shelley. There we go. So this is a screenshot of the attestation portal. So you have 30 days once you get that money deposited into your account to go into this portal. You need your tax ID number and the last 6 digits, I think, of your bank account that the funds were deposited into, and then what the dollar amount was of that deposit. Make sure you do that within 30 days. And this is also you accepting the terms and conditions of the fund. And yeah, go ahead, Shelley. That's the next one here. So this is linked within that same page. It'll take you to what the terms and conditions are. Like we said last week, pretty broad terms and conditions, including a focus on using the funds to offset revenue declines that are related to call volume declines that are in turn driven by COVID-19. So patients refusing or not calling 911 because they have a non-COVID-19 issue and they don't want to go to a hospital or be transported anywhere for fear of getting contaminated. And then finally, also, this is also linked in the agenda item, and then there's a resource document for it. There's a great FAQ section in the American Ambulance Association website. I think, I'm not sure. I don't think that's it, Shelley.
Okay.
Oh, maybe you're right. You got it. I'm sorry.
Okay.
This is a pretty good overview. Some providers got funds deposited into their account last week. They're not sure they want it. It goes into what you can do to opt out of that. And the last thing I'll say is it's not really spelled out in detail, but this happened pretty quick. It's pretty broad terms and conditions. One thing is that at a minimum, CMS is going to follow up with what their reporting requirements will be for these funds. And so the longstanding caveat with this is make sure you document the usage of those funds and always be expecting some downstream questions or an audit.
Thank you, Jason. Thank you so much. Let's go ahead and keep moving on to Edward, if you please.
Okay. Specifically, what I was going to give information on was the allocation for the treatment of the uninsured. In the document, it talks about the CARES Act and how it provides for patients who have no insurance, okay, and how us as providers can get reimbursed for that.
Let me interrupt you 1 second. The CARES Act, please, Shelley. The HHS CARES Act.
Yes, that's correct.
Yes, thank you.
If you notice on the second part, it talks about the program, and it specifically identifies testing uninsured patients and treating uninsured patients with COVID-19 diagnoses. What it specifically identifies is how it's going to work, and the information that you need to get yourself in that position. You need to, the steps involve enrolling as a provider participant, checking patient eligibility, submitting patient information, submitting claims, and then receiving payment via direct deposit. You must attest to a specific information, specifically that the patient is specifically uninsured and that you verified that they don't have any kind of insurance. That you have to attest that you'll accept defined program reimbursements and what as full payment, which basically they're identifying as Medicare reimbursement. You agree not to balance bill a patient, and you agree that you're subject to post reimbursement audit review. So you need to make sure you keep your records very specific. The program timeline, they just put it out yesterday. April 27th is the sign up period. May 6th, you can begin submitting claims, and then in mid-May they get reimbursement. This program specifically identifies that on this has to do with any claims for patients you've treated with the COVID-19 that were after February 4th of this year, and then it continues there. So you can claim patients that you've treated in the past through since February 4th. It's specifically in the last part of the document, it identifies that emergency ground ambulance transportation and non-emergency patient transfers via ground ambulance are covered, and the specific content and training will be available on April 27th. If you look at the very end of the document, it tells you where you can go. You can actually access information through Twitter, Facebook, and LinkedIn.
Thank you, Ed. Thank you. Just to kind of piggyback on what Ed was saying as well, too, on that HHS CARES Act document, there's actually part of Ed's section states that every healthcare provider is eligible for submitting for this funding for the uninsured. So if you tag that along with what CMS considers to be a healthcare provider, quote unquote, is stated as a person who is trained and licensed to give healthcare, also a place that is licensed to give healthcare. Doctors, nurses, hospitals are examples of healthcare providers. So this bit is actually not just specific to ambulatory care. It's also helpful for hospitals, primary care physicians, even doctors who treat patients one-on-one. So there's a lot of different ways that this can be used for that purpose. If people who are uninsured are seeking care, this allows them to at least get the Medicare rate. Now, there are hoops to jump through, and so each CON provider or hospital or private practice or private practitioner would need to ask themselves whether or not those hoops are worth jumping through to get that Medicare rate for that population that they serve who is uninsured. So that's only something that each provider can answer. That's not something that we can tell you this is the best practice for you. It just depends on what your population is. So if you have a very large amount of uninsured persons that you are struggling to get payment from, historically speaking, those hoops might be worth it for you. It depends. So that's something that you folks will have to consider. We're definitely here to assist. If you have any questions about that, if you want to ask or discuss it more in depth, you've got my email. Feel free to give me a ring. That HHS CARES Act, if we can go back to that, Shelley. There's a part there that says targeted allocations, and there's information in there where, again, this is being distributed for targeted hospitals who need to also apply for these funds, and also for allocations for rural providers at the bottom of page 3, and even allocations for Indian Health Services on the beginning of page 4. Now, these rural providers and the Indian Health Services, it states that they're distributed next week on the basis of operating expenses. If you're a hospital, you will have to apply. So this document here has a lot of information, and it just was published yesterday. And per the timeline that Ed gave us in the HRSA, that timeline where the details were launched yesterday, sign-up period begins on Monday, the 27th. Shelley, if we can kick back to the HRSA, thank you. And then training for how to apply, how to submit, and everything to that effect begins on April 29th. So definitely ask each other, ask your departments as to whether or not this would be helpful, to see whether or not this is something that would benefit your group or not. All right, we skipped over Paul at the beginning for those of us who joined us a bit. So let's see, Paul, are you there? Can we go through the call volumes? Paul? All right, I guess we're having issues with getting Paul on the phone. All right, so then I'll continue. Closing remarks would be our last week's presentation is on our website, the Ground Ambulance homepage. We recorded it and posted it online. If you did not see that in the email, please do check that out. It's got some information, especially regarding Small Business Administration and the funding that's available there. And I would definitely recommend see that. If you have any questions after you saw that already, we will definitely have a time for Q&A. Speaking of SBA, for those of you that saw, it looks like this is slowly moving towards getting approved for a second round of funding for the EIDL program and for the payroll protection program. So if you did not get your foot in the door before it ran out of funding, it will definitely get some funding again. Shivani is penciled to present with us next week on Thursday so that we can have the utmost direct information, most current information once it gets published, because we are under the impression that it's going to get approved right before our meeting. That SBA funding is going to have allocations specific for hospitals, rural providers, and medical centers. So if that is you, then this is definitely something that you will want to look into that. And if you're not familiar with the payroll protection program, that is definitely helpful for for-profits, nonprofits, and tribal entities when it comes to getting coverage for that, which to my knowledge will get forgiven later down the line. So definitely some good funding opportunities there. You have Shivani's information. If it does hit and we can't have a presentation right away, I would recommend you contact Shivani directly. That is her email address at the bottom of the agenda. She will get back to you. We also have the EMS and 911 resources website there on the agenda, the email for COVID questions, if you have any. So I apologize that we're having technical difficulties with Paul. Paul, are you there? Looks, he's texting me. He's saying he's on here, but we can't hear him.
Do you know what phone number I can't tell what phone number he's associated with, otherwise I might be able to unmute him. Darn it.
I do know his phone number, but I don't know if I want to like state that to the world. I don't know if he would appreciate that.
Yeah, they're blocked.
I can text it to you, but I think we're running out of time here. I can open it up for Q&A while we try to get Paul on the line. Are there any direct questions about any of the different programs that we have presented on or the recording that was posted to the website? If you wanted to unmute yourself and ask any questions that you might have.
Elizabeth Warren shared in the chat that a *6 will help him unmute himself.
Did you hear that, Paul? *6?
Yes, I'm here.
Yay! Thank you so much. Thank you.
Yeah. Sorry about all that.
Awesome. Go ahead. Call volumes.
So okay, I got 6 points I want to hit. Number one is that as I mentioned last week, anybody who joined in last week, is that call volumes nationwide are still down, and certainly we're seeing that, and I suspect everybody else is too. That also is including hospitals, EDs, physician offices, etc. There have been a couple of national stories over the past week, one out of DC, one out of LA, about EDs and how the ED docs are very concerned that people are staying home with chest pains, people are staying home with stroke symptoms, and just because they're afraid that the ED is just crawling with COVID-19. So it's a real issue, one of those unintended consequences out of all the public awareness information that's come out about COVID-19. Secondly, with respect to our employees, I've got 3 out of 50, which is 6% of our workforce, out with COVID-19. And to that end, we've put together some policies. We've got one as a health screening guide. We've got a pay practice guide, and we're working on a return to work policy. We felt it was important that, because this is going on, that our employees know exactly where they stood if they get sick. So we've done that. Anybody wants to see ours, we did some plagiarism a little bit and then tailored it to ours. And if anybody wants a copy, be glad to share it with you. The next piece is on employees who do have COVID-19. If you get or got anybody out, make sure that their insurance companies aren't billing them for COVID-19 related expenses. The laws that have been passed over the past several weeks have included that insurance companies cannot charge for this. So just like I say, make sure your insurance companies aren't charging your folks for these expenses, because they're not supposed to be doing that. Next topic is testing. Right now, the CDC guidelines are that you have to have symptoms to be tested. There are some ways around that, I guess, but we feel it's really important, especially with a small workforce, that if we get too many people sick, it's going to impact our operations, which would in turn impact our neighbors' operations. So we have encouraged DHS to, as testing becomes more prevalent, to make sure that EMS is at the top or real close to the top of the list of folks who get testing early on. And I would encourage everybody on the call to do the same thing, to encourage anybody you can to remember us with testing. And the last point I have is that, and I think Catherine touched on it, is that attached to this is a patient release form that was put out by PWW. They are an East Coast law firm, probably the premier EMS law firm in the country. And they put it out on their website, so it's there for anybody to customize, use if they're so inclined. Catherine?
Thank you so much, Paul. Glad we were able to get that tip. Again, thank you so very much.
Yep.
Appreciate it for the star 6 tip. Thank you, Ms. Warren.
Yeah, thanks.
Yes. So a lot of information here. I guess the takeaway would be to review these terms and conditions. Be sure to complete that attestation within 30 days. There is a clock on that. If those funds are something that everyone wants to keep or wants to get, if you didn't get the first payment, that payment should be coming tomorrow if you haven't gotten a first, or if you did get a first payment, second payment's going to be coming out tomorrow. And review to see if this uninsured terms and conditions works for you, to see if that is something that is beneficial to your program. Maybe not. And with these tax deduction changes, that opens up the possibility to getting other donations, whether or not from individuals in your area or whether or not from large donors in your area. There's a lot of information here. We are really lucky to get this information right when it hit. So please, if you have any questions or any experiences, if you do go into this program, please share that with us. That's valuable to us as well too. So that's about it. If anyone's got any questions, looks like we finished early. So any questions, if anyone wants to unmute themselves and ask. If not, you can always email me later. I guess that's none.
Yeah, I don't see anything in the chat window.
All right. Well, thank you so very much for joining us. Next week, like I said, Shivani will be joining us to give us more information about the SBA